Hello and welcome to McLaren Port Huron Today's Health Program. I'm your host, Kelly DiNardo. McLaren Port Huron has provided the highest level of breast cancer care services for more than 30 years. And in today's program, we're going to learn about the latest technologies in breast cancer care. And to begin the program, I'm speaking with breast surgeon Dr. Kimberley Clark-Paul. Dr. Clark-Paul, thank you so much for speaking with us today.
Thank you. Can
you tell us a little bit about the breast cancer care services at McLaren Port Huron?
Yes, we're very, very pleased. In 2019, McLaren Port Huron became an NAPBC Breast Center of Excellence. That's a national accreditation program for breast centers. So we're one of very few actually in the country which has this designation.
Can you tell us a little bit how this designation maybe sets us apart from other facilities?
In order to achieve the designation, there are multiple standards in multidisciplinary groups that have to be met. Not only do you have to meet these standards, but you actually have a surveyor from the national program that comes and reviews your program, and you have to continue to meet these standards in order to keep your accreditation. So we are truly set apart from other centers.
This sounds like it's a wonderful advantage for all of our patients.
It's fantastic.
So you talked a little bit about the team. Can you tell us a little bit more about who's all involved in the care?
Yes, so what's very unique about breast cancer, and probably cancers in general, is that it's not just one specialty that cares for the patient with that tumor. In breast cancer, you have a surgical oncologist, you have a medical oncologist, you have a radiation oncologist, but none of us can do what we do without the pathologist who looks at the tumor first and tells us the behavior of the tumor and whether or not it is a cancer. So we have a pathologist. We also have our radiologists, which are very instrumental in the diagnosis of the tumor and in how extensive the tumor might be in the breast. So we have multiple specialties that all are necessary to work together. Now those are only the physician specialties. You can imagine how complex it could be for a patient to navigate that system. And so we have a nurse navigator who actually helps the patient through seeing and interacting with all those different specialists. But not only do we need that, but you can imagine we're not just treating a cancer, we're treating the patient and the patient's family. So we have social workers, we have other nurses, we have all of the support services that we need in order to make this unpleasant diagnosis for the patient the best that it can possibly be with the best outcome.
So that sounds like a wonderful opportunity for the patients really to get the best care and everyone working together.
It is the only way that if you're not involved in a breast center, I don't know how your care can be coordinated appropriately.
Yeah, that's wonderful. Tell us a little bit about the spectrum of care or the services that maybe are available for women that would come to our center.
So what I think is very, very important is that we have weekly breast tumor boards. And so at that breast tumor board, all of those specialists that I just mentioned are actually present, and we actually look at, all of us together look at the x-rays, we look at the pathology, we have the slides projected, we discuss what are the latest trials and that the patient might be eligible for. So we have all of those different things for each patient. Their care is tailored and specialized to that patient. I was at a recent conference and I really liked something that one of the presenters said. He said, we develop a flight plan for the patient. And that's kind of what I think that term is a good term. We develop a flight plan for that patient, which is in the very best interest of that individual patient with that individual tumor and the biology of that tumor.
This is wonderful information. We do need to take a short break, but we will continue this discussion when we return.
All right.